Hello and welcome to yet another episode of Tablet. Today we have with us Dr. Abraham Varghese, who have been specialized in occupational health. Let us welcome him to the program. Welcome, Doctor.
Hi,
Firstly, we would like to know more about you.
I am Dr. Abraham Varghese, an occupational health physician attached to Binani Zinc Limited. It's a factory which manufactures zinc located in Binanipuram, Cochin. This is basically manufacturing zinc. We have two byproducts, that's cadmium and sulfuric acid. I am in charge of the Occupational Health Center attached to the Binani Zinc Limited.
We have received some questions and doubts regarding occupational health from the viewers, mainly from UAE. So we will move on to the questions. So the first mail is from Muhammad Ali, Abu Dhabi. Doctor, first of all, can you tell me what is occupational health and what are the main services provided? What do we mean by managing absence and return to work? How confidential will occupational health records be, and how does health surveillance work?
Good. Occupational health is health of the worker in relation to his work and working environment. The World Health Organization has defined occupational health as the promotion and maintenance of the highest degree of physical, mental, and social well being of an individual in relation to his work and the working environment. It's a classical definition of occupational health. Now, when we talk about occupational health, it's basically related to one's occupation. There are many disorders associated with one's occupation. So when we talk about occupational diseases, there are diseases associated with one's occupation. Now, as Muhammad Ali has asked me, he wants to know how work and the absence is related. Now, when you have absence related to a occupational problem, then that's a work-related disorder, and his leave has to be a medical leave. If it is a work-related problem, that has to be investigated and found whether it is a genuine work-related problem or not. So for which he has to undergo a medical examination. The medical examinations are regular screening of the employees. When we talk about occupational health, we focus mainly on prevention. That's a basic service which we are providing. Normally, when you go to a hospital, it's when you fall sick, you need the consultation and you need the treatment from a doctor. So here, as an occupational health physician, what we preach is occupational health, means preventive health. So you undergo regular screening. As far as the employee is concerned, whatever field he is working, he undergoes regular screening, so that the employee and the management knows about his status in the factory.
So the next mail is from KC, Abu Dhabi. Doctor, can you tell me the difference between occupational medicine and industrial medicine? And how do I know when I should book an appointment with an OHCC? How does the OHCC team work with my primary care or other doctors? And how much does it cost to use the services of an OHCC?
The first part was how do you differentiate industrial medicine and occupational medicine? See, it's one and the same. Earlier, about 2 decades back, we used to believe that all the hazards are due to the industrial related issues. So we used to call it as industrial medicine, industrial health, industrial hygiene. Every terminology was related to industry, thinking that it is only industry which is creating all the problem for the individual. Now that concept has gone. Now we say that it is occupational related problems. So that's why we call it as occupational medicine, occupational health, occupational hygiene and all. Because any illness which happens as a relation to the occupation can be an occupational disease, and hence the terminology now is occupational medicine.
Okay.
That's the first part of the question. Now his question is about the OHC which provides services, the second part, where the OHC is Occupational Health Center. That's a center which gives primary care to the employees. Primary care is a total care as far as the employee is concerned, is preventive as well as curative service. Curative service is the one which you get when you go to a hospital. The preventive services is the screening for the employee so that he is prevented of the hazards in the workplace. So when you go to an occupational health center, you can have all these preventive screening there. So there is no hard and fast rule as to 1, 2, 3 tests to be undergone.
So the next mail is from Casey, Abu Dhabi. Doctor, can you tell me the difference between occupational medicine and industrial medicine? And how do I know when I should book an appointment with an OHCC? How does the OHCC team work with my primary care or other doctors? And how much does it cost to use the services of an OHCC?
The Occupational Health Center is known as OHC. The Occupational Health Center is a center which provides basically preventive health care for the employees. So when we talk about preventive health care, the occupational health physician has to design a test which is suitable to the individual. For example, different employees working in different locations need different tests. So the occupational health physician has to design the tests which are required for the particular individual.
How do I know when I should book an appointment with an OHCC?
Yeah, this is, as I mentioned, this is a regular screening of the employee. So when an individual approaches the occupational physician, as I mentioned earlier, he advises so and so test, and with the test results, he has to go back to the occupational health physician again. That's the time when he interacts with the individual and tell him as to what precautions he should take. Maybe he is exposed to high noise, maybe he is exposed to so much of dust. So depending on that, he has to be advised as to what he should do, the individual should do. And maybe depending on the test results, some advices has to be given to him. Sometimes a stage may come when the occupational health physician needs the support of some other doctor. Maybe the same patient has to be referred to an orthopedician. Maybe the patient has to be referred to a neurologist. But it's the occupational health physician who is primarily screening the employee. So that part is done by the doctor, the occupational physician, and then he has to be referred to an individual probably for any expert opinion.
So we have received next mail from Faisal Ajman. Why is pre-employment fit for duty testing a good idea? And what health and wellness services do you provide? What insurances do you accept? And last, what travel medicine services do you provide?
That's a good question from Faisal. We will take one by one. The first part is what is the relevance of pre-employment? And it's a good idea. That's what Faisal has said. Now, Faisal, for your information, pre-employment medical examination is a medical examination which is done at the time of recruitment to a firm. Any individual XYZ, when he is chosen, he has to undergo a medical examination for the entry point. So that's a pre-employment medical examination. So when you do a pre-employment examination, the main purpose is whether this particular individual is fit for that particular post or not. Maybe a worker category, maybe a nurse, maybe a mechanic, maybe a chartered accountant, whoever he is, whether he is fit for that particular job. So that's a pre-employment medical. That, as mentioned by Faisal, that's definitely a requirement of the factory. Every factory or every organization takes people with, they want only healthy people. So that's why we do a pre-employment medical examination.
What health and wellness services do you provide?
In an occupational health center, we provide both preventive and curative services. Curative services is the treatment side. When a patient comes to you, you got to treat him. That's one side. The other side is the preventive part. That's basically the monitoring of the individual, where depending on his job he is doing, he may be exposed to various hazards in the workplace, or any hazard in relation to the job is also taken into account. So you got to address that issues, and advise him accordingly. So the first test which we mentioned was pre-employment. Then it comes the periodic medical examination. That is once in a year, as per the Factories Act, it is statutory. So at least once in a year, you have to undergo a detailed examination. That may include blood urine examination, vision testing, lung function testing, audiometry, ECG. There are various tests. So the physician has to design which are the tests which this particular individual is required. So that's a periodic medical examination. The third medical examination, which we usually call it, is a separation medical examination. That is at the time of retirement. When somebody retires from the particular firm, we have to ascertain whether he is his health condition. So at the entry point and the exit point, we got to examine him and see whether there is any deviation from the normals.
Lastly, he asked, what travel medicine services do you provide?
Normally, Occupational Health Center doesn't provide any travel medicines. Travel medicines, again, depending on one's requirement, maybe he's diabetic, maybe he's hypertensive, depending on one's illness, he has to consult his regular doctor and find out what are the medicines to be carried, even in times of an emergency, what are the medicines to be taken. All he has to consult with his doctor and finalize. So that's how it should be the normal treating doctor who should advise him during his travel as to what medicines he should take.
Okay. Moving on to the next mail. Mahim from Sharjah. What tests are involved in occupational health? Do employees have to take a part in health surveillance? And if a problem shows up during an employee's health surveillance medical, what happens?
Mahim, that's again a very good question. He has asked what are the tests which are being done. As mentioned earlier, the test has to be finalized by the doctor, the occupational health physician, depending on what type of job which he is doing. On an average, every employee has to undergo blood urine tests. This blood test should include all the routine examination plus blood biochemistry like lipid profile, blood sugar, kidney function test, liver function test. All these tests are required basically. And now routine urine examination also is mandatory. Now in addition to that, some physiological tests are usually advised. Say for example, somebody who is a crane operator, a driver, his vision has to be tested. Now people who are exposed to dust, naturally we have to do a spirometry. This is basically a lung function test to find out how efficient your lungs are. Maybe if you are continuously exposed to certain dust, you may have problems with your lungs. That is visible from this spirometry finding. Now ECG, of course, for everyone we should do a ECG examination, and with all the test results, the doctor has to see the patient.
If a problem shows up during an employee's health surveillance medical, what happens?
That's a major concern of the patients usually. They all ask if something goes wrong, am I going to lose my job? That's the usual question. That's what again he has asked. Now, when we do a health surveillance program, there are many findings which we communicate to the patient, so that the patient should know as to what are his problems, what are his health related problems, maybe a lifestyle disorder, whatever it is. That has to be told to him. But when we communicate to the patient, that is definitely a confidential report. That doesn't mean that even if something goes wrong, he is going to lose his job. No. Because we have done a pre-employment medical examination and found that he is fit for the particular job. That's why he got his job. So once you get fitness from the pre-employment, that means he is fit for the particular job. Now, even if he falls sick or some major problem comes, he is not going to lose his job. That was his concern. No, he will not. But it's our responsibility from the Occupational Health Center to advise him on what are the preventive measures he should take so that he doesn't get more issues in his later life. or whatever issues are there, that has to be controlled. So these are mainly control measures which he has to adopt in his personal life.
And we have received next mail from Sabah Omar, Dubai. How do I report an incident? What should I do if I have a health and safety concern at my workplace? And where can I find information about hazard assessments? Where can I find health and safety information for my industry?
Any accident or incident which happens in a factory has to be reported to the management. So, as far as a management is concerned, they should definitely show concern about the health of all the individuals. So, most of the companies have got certification by ISO 18001 that covers occupational health safety management system. So, any factory with ISO 18001 certification has got a definite OHS policy that covers the entire aspects of occupational health and safety. So when you come across an accident or an incident, if at all, this has to be reported to the management. So once it is reported to the management, it is up to the management to take a action regarding that. If an accident happens, naturally further investigations has to be done as to why it happened, what happened, and where it happened, and whether it could be avoided. Maybe the employee has not used the personal protective equipment. Maybe there was some unsafe act in that particular spot. So when an accident happens, this has to be reported to the supervisor first. The supervisor in turn has to report it to the management, and there are safety committee members, union leaders who should also be involved in such an investigation procedure. So our purpose should be to avoid such an accident in future. If at all something wrong has happened, this should never be repeated. So that is the purpose of a occupational health safety management system in a factory.
Where can I find information about hazard assessments?
Hazard assessment is basically done in the factory itself. Every job has got various hazards linked to that. Hazard is a potential for causing a harm. So when there is a hazard which is detected, we have to assess that situation. So it's a multidisciplinary approach. You may need the services of people in different fields. And it is a cross-functional team which is also involved in this hazard assessment, where the supervisor, the safety manager, the medical officer, the man who is responsible for that particular job, all these people should together sit down and assess the hazards linked to that particular job and find out the control measures for that. Maybe you have a chance of an accident which can occur in that particular department. Find out what are the control measures which you can adopt in that particular department. So in consultation with the management as well as the workers also. So you come to a good preventive control measure which can be adopted in that particular department.
She has even asked, where can I find health and safety information for my industry?
If your factory is certified by Occupational Health and Safety Management System, that means your company already has got a system where you get all the details there. So when you have a system being implemented in a factory, that factory should have a management representative who is responsible for that particular certification. So you can get all the information from that individual. Doesn't mean that only one individual knows about that. The supervisor, the workers, everybody should be aware of the policy decision of the company. So he should get the information from the factory itself.
Doctor, you had forgot to answer one question, that was, how do I report an incident?
Incident is an event that can give rise to an accident. An accident, usually we all know it's an accident in every sense. There is loss of life and various other issues connected with that. Now, incident can always lead to an accident. So there may not be an injury, there may not be a loss of life, but still incident, we consider it as a major event because any time this can lead to an accident. So when there is an incident which happens in the factory, this has to be reported to the management. So there is a format for that, which includes your age, sex, what type of job which you are doing, whether personal protective equipment were used, and how did it happen, what was the job which he was doing, and what was the likely injury which can develop. So all the details has to be there in that format.
So the next mail is from Miriam Sharjah. As an employer, do I have to tell my employees that they are being referred into occupational health? And what makes for a good referral into occupational health? What type of injuries can be referred to physiotherapy? And do I need a GP referral to come for a physiotherapy?
As an employer, the individual should have a definite tie-up with the employees in relation to the occupational health and safety. It's the responsibility of the employer or the occupier to build up an awareness among employees on what occupational health is. So it is the responsibility, the prime responsibility of the employer or the occupier to see that the employees are made aware of occupational health and safety system. Now, when you adopt a occupational health safety management system, all the employees have to have a regular screening, which we call it as the health surveillance program. This health surveillance program has to be adopted in an industry, especially if it has got a occupational health management system. So the employer has every responsibility to communicate with the employees regarding the health screening, so that the health screening is made mandatory for all the employees.
What makes for a good referral into occupational health?
When it becomes mandatory that this has to be automatically done, the regular screening of the employees has to be done. That's what we call it as health surveillance program.
The last question is, what type of injuries can be referred to physiotherapy? And do I need a GP referral to come for physiotherapy?
See, when you have a health screening in your factory setup itself, if you have an occupational health center, there of course you have a doctor. So that doctor should be able to assess your situation after an accident, after an injury. So you don't need a GP reference for that particular case, because it's the factory medical officer who has been evaluating you throughout, and he knows what are the restrictions you have. So when you report after an injury or after an accident, maybe you may need physiotherapy. So your doctor in the factory should be able to refer you to a physiotherapist. And the physiotherapist will decide as to what type of physiotherapy exercises you need for your improvement. So this is always done with a joint consultation of the factory medical officer, who is your occupational physician, along with the physiotherapist, can decide on what exercises you require to make further improvement.
So doctor, what advice you would like to give to the viewers?
See, the success of an industrial establishment depends on the health of its workforce. So when you have healthy workforce, you have a productive company. So you need productive workforce, for which regular screening is a must, and regular periodic examination of all the employees in the factory should be made mandatory, especially if the company is having a occupational health safety management system. That is the only advice which I want to tell you all. All the employees should be healthy.
Doctor, thanks a lot for being a part of our program. So that was Dr. Abraham Varghese with us. Until we meet next time, this is me, Nana, signing off. Take care.